Now we have the second of our talks from Michael Marmot on social justice and health equity. So please welcome Michael back to the stage. Thank you.
Social injustice is killing on a grand scale. We put that on the cover of the World Health Organization Commission on Social Determinants of Health. We showed there were huge health inequalities between countries and within countries. We said putting them right was a matter of social justice. They're not fixed. Ola Rosling showed us this morning how rapidly they can change. They can get smaller and they can get bigger. And within many high-income countries, health inequalities have got bigger. Social injustice is killing on a grand scale. It may seem very complicated. If these social and economic inequalities are really the cause of health inequalities, they're so deep-seated, what can we do about them? We reviewed the evidence. We said inequities in the conditions of daily life, the conditions in which people are born, grow, live, work, and age, and inequities in power, money, and resources give rise to most of the inequities in health that we see. Now, this was a global commission for every country in the world. I'm going to give you the example of my own country, the United Kingdom. I was asked back in 2008, after we published the WHO Commission report, which I led, could you do a report translating the findings and recommendations of your global report for one country, England? I published a report. It became known as the Marmot Review, that's me, and we called it Fair Society, Healthy Lives. It was a statement that health is telling us something fundamental about how well society is meeting the needs of its members. If health is improving, it's a reflection of the fact that society is improving. If health inequalities are getting bigger, it's a reflection of the fact that inequalities in society are getting bigger. To put them right, we need a fairer society. Well, that sounds all a bit airy-fairy, fairer. We had initially 6 domains of recommendations. Give every child the best start in life, education and lifelong learning, employment and working conditions. We said, number 4, in a rich country, everybody should be able to feed their children. They should have enough money to pay the rent. So minimum income for healthy living. 5, healthy and sustainable places in which to live and work, including housing. And 6, taking a social determinants approach to prevention. We've now added 2, tackle racism, discrimination, and their outcomes. And of course, the 8th one should have been there all along. Pursue environmental sustainability and health equity together. I produced my report in 2010. Now, I maintain the fiction that I'm not party political. I just look at the evidence. What happened after I produced my report? We had a change of government. Correlation is not causation. I don't think my report led to this. But we had a change of government. The Conservative-led governments that we had went completely in the other direction. They increased child poverty, they stopped spending on education, they reduced funding to local government. And 10 years on, I produced the Marmot Review 10 years on, and I said life expectancy had more or less stopped improving. Inequalities in health had got bigger. In fact, we calculated that arguably austerity had led to 148,000 deaths. If government policy led to 148,000 deaths, I think you could say that social injustice is killing on a grand scale. People living in the poorest communities, their life expectancy went down and their health got worse. The second most common question I get asked is, why aren't you depressed? You've been purveying these messages for some time, and no one seems to be listening. They are listening. The English city of Coventry declared itself a Marmot city. They took my recommendations and said, they may not be doing it nationally, we'll do it in Coventry. And it wasn't the health and care system, it was the city council, the voluntary and community sector, the police, the fire and rescue service, education, working together. So I went to Greater Manchester, said Coventry, you know, who's heard of Coventry? If Manchester did it, everybody's heard of Manchester. The mayor said, do it. So we worked together. Then I went to Liverpool, said, do you know what they're doing in Manchester? So we did a report. Then I went to Newcastle and said, you know, Scotland said they want to be a Marmot country. By early next year, we will have 50 Marmot places in England, Wales, and Scotland. I used to go around the world saying I was an evidence-based optimist. A Brazilian colleague pointed out to me in his thick Portuguese accent, you're using the English language incorrectly. You're not an optimist, you're hopeful. The difference is optimism and pessimism, two sides of the same coin, express an absolute certainty about what's going to happen. It's going to get worse or it's going to get better. Hopefulness is something different. Hopefulness is a stimulus to action. In fact, why would we act if we weren't hopeful? Václav Havel, Czech dissident, playwright, and first leader of post-communist Czechoslovakia, said, hope is not prognostication. It's an attitude of the spirit. It's doing the right thing regardless of the outcome. Colleagues, I invite you to join me in my hopefulness that we can create a fairer world. Thank you. Thank you.